Hi, my name is Jazzie Encarnacion, and this is my wound care video. So first and foremost, I'm going to check the patient's medical record to ensure that I'm administering the proper dressing change procedure, to make sure I have all the correct materials. And I'm then going to check for any PPE that I might need. In this case, it's universal precautions with this patient, so I don't need any PPE. Next, I will go into the patient's room, identify myself, and check the patient's ID band. So, let me that right there. Good morning, Mr. Jenkins. My name is Jazzie. I'm going to be doing your wound care today. First and foremost, can I see your ID band? And can you please state your full name, age, and date of birth for me? Perfect. And are you in any pain today? No? Awesome. If the patient was in pain, I would make sure that I administered the proper prescribed medications by the physician, and I would wait about 15 to 30 minutes before doing the procedure. But in this case, we don't need it. Next, I will close the patient's curtain or door for privacy, which we don't have, and I would assist the patient to a comfortable working position for both he and I. So is this a comfortable position for you, sir? Perfect. Next, if I could, I would raise the patient's bed to about waist level to work in a comfortable position. However, we cannot do that in today's circumstances. Next, I'm going to make sure my materials are gathered, which I have them all gathered right here, as well as I have a waste receptacle nearby to throw away all my trash, and I have my second bedside table to put my all my sterile items. Next, I'm going to perform hand hygiene, and I'm going to put on clean gloves. Okay, now I'm going to uncover the patient's wound, just enough for me to be able to undo their wound, but also keep them partially covered. Next, I'm going to remove the old dressing that has the initials, date, and the time on it using the push and pull method, making sure that the patient is in no pain as I remove the old dressing. Are you in any pain, sir? No, great. Okay. Okay. Now I'm going to look at the old dressing. I'm going to look for the appearance of drainage, what kind of drainage type, the amount, the color, and any odor that may be present. And as we can see here, there is none. So now I'm just going to discard of the old dressing. And then next I'm going to take some Q-tips. I'm going to open it up, and actually I'm going to take these. I'm going to take some some Q-tips, and I'm going to take one out. The other one can be discarded. And I'm going to measure the patient's, well, before I do that, I'm going to look at the wound for any active drainage, any eschar, some necrosis, as I can see here, epithelialization, or granulization that I see there, any sinus tract, any undermining, tunneling, active drainage. And at this point I would stage the wound, which this appears to be a stage 3 wound. And then I would measure the wound with the Q-tip. So it is about 9.5 centimeters long. It's about 6 centimeters wide. I'm going in at the deepest part here. I would say that it is about 2 centimeters deep. So once I've done that, I can discard of this. So now that I've done that, I can remove my clean gloves here. Discard of those. Perform hand hygiene once more. And now I can set up my sterile field. So I have my sterile gloves here. And I'm going to lay out a waterproof pad underneath the patient's wound. Okay. I've already cut my tape for today, and I have my pen here to mark it. So next I'm just going to open my drape and proceed to remove it by the corners. Okay, so now I will administer all of my materials onto it. I'm going to open everything away from me and drop everything in at around 6 inches. Discard. Discard. I'm going to keep that at the very edge of my table if it was big enough, because the plastic is not sterile. And I'm going to put that right underneath my drain here. And then I have my sterile water, which has been opened but less than 24 hours. So I'm going to keep this at the 1-inch border of my sterile field, since the inside is sterile, and I'm going to flip the sterile water, and I'm going to pour some into my irrigation tray, as well as just on top of the wet gauze. And I will take that and I will keep that on the side. Okay, next I'm going to put on my sterile gloves. So I'm going to open my package. And I'm just going to do it on this table since I don't have another table, but normally I would make sure that I had another table to do this. All right. And now that my sterile gloves on, I pinch the middle and discard of that. Now I'm ready to do my procedure, and I can set up everything that I will need here. Okay, now I'm going to take some normal saline, and I'm going to grab the irrigation tray. Now this hand is no longer sterile, and I'm going to place it tightly against the wound, and I'm going to direct the flow directly on top of it at a downward angle, and I'm going to irrigate it twice at least, or until the liquid one's clear. I'm just going to drop some more liquid here. And there we go. Now that I've irrigated it, I'm going to put down my thing. I'm going to grab some gauze and transfer it to my clean hand and pat the wound dry. Clean hand, patting it dry as I do this. Okay, next I'm going to take a Q-tip, transfer it to my clean hand. I'm going to transfer it to my clean hand, and then I'm going to take some wet gauze and I'm going to accordion fold it in my hands, and I'm going to place it on the wound and use the Q-tip to place it inside of the wound. And discard of this Q-tip. And then at this point I would put on any skin barrier that I need. So I would do this, or any ointments that I would need in the wound, any antibiotic topicals. So I put that on the wound, and then I will cover the wound up. At this point I can use both hands to tape it down. Move that out the way now that I no longer need it. Remove the checks pad. Okay, now with this last piece of tape, I'm just going to write my initials, the date, and the time in which I completed the wound dressing change, and place that on the wound. Make sure my patient is comfortable. Can then remove my sterile gloves, perform hand hygiene, and clean up my area. And that is my dressing change.